Hello, 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 and welcome to our live nursing news you can use live at 5. I'm Tina Baxter, your host. Thank you for joining us today. We're running a little bit behind because we had such an awesome day. We had a chance to get our CNA students off and continuing their class, as well as had a chance to have our TB class today. And had great discussions with those leaders as well. So I just wanted to go ahead and jump in. Today is October 23rd, 2024, and welcome to the show. So let's go ahead and get started with our affirmation for today. So our affirmation is coming out of the Louise Hay calendar, and it happens to be today's affirmation. And it says, Joy opens many doors for me. My self confidence is growing. Joy opens many doors for me. My self confidence is growing. So that's our affirmation for today. We do have some news to go into today. So we'll be heading into that news shortly. And then I want to say that some of the things we're going to do a little bit differently is we are going to start sharing a little bit about our other show, which is the Nurse Shark Academy show. And I thought I'd share a little clip here right with you. So, exclusive little clip of our other show, the Nurse Shark Academy show, where I interview nurse business owners and leaders. And so I wanted to let you know that that is also going to be available to you today. So we're going to have a sneak peek for that. But first, the news. So here's our first story. And this is coming from, let's see here. This is coming, right, it's a little small and tiny. So anyway, this is a story about local leaders disappointed by the veto of a bill aimed at the nursing shortage. So this is, again looks like coming out of I believe Michigan, and it says a bill that would have started a pilot program for community colleges to offer bachelor's degrees in nursing was vetoed by Governor Gavin Newsom, who cited other state programs in place to help address a statewide nursing shortage. Senate Bill 895, authored by Senator Richard Roth, a Democrat from Riverside, passed both houses of the state legislature without issue. Senator Scott Wilk, a Republican from Santa Clarita, this is out of California, is listed as one of the co-authors. Locally, College of the Canyons and Henry Mayo Newhall Hospital officials expressed disappointment in the veto. Should the bill have been signed and become law, 10 community colleges would have been selected to participate in the program, with the California Community Colleges Chancellor's Office picking those based on specified criteria. So this is out of California. And we reported previously about the bill passing both the House and the Senate, but unfortunately, the governor, for whatever reason, vetoed it, which I find surprising. The Legislative Analysis Office would have conducted an evaluation of the program by July of 2032. And since California has had a shortage of registered nurses for decades, the bill text reads, the shortage has been exacerbated in recent years due to a global pandemic and is expected to worsen due to projected retirements. While this is a national problem, it is particularly acute in California, where there are only 995 registered nurses per 100,000 people, ranking 40th out of 50 states. California nursing school capacity has been insufficient in keeping up with the demand. In a letter to the Senate announcing his veto, Newsom cited $60 million per year through 2029 that is budgeted for the Rebuilding Nursing Infrastructure Grant Program, along with community colleges being granted, quote, expanded authority to offer independent programs in recent years. These types of partnerships have proven successful in expanding BSN access for community college students and increasing the number of BSN degree recipients. All segments of higher education should continue to focus on building these programs together, and I'm concerned this bill could inadvertently undermine that collaboration. So you have questions about that. I'm just wondering if some of the local 4-year degree schools oppose this. I don't know. We'll see. To override the veto, the legislature has 60 days from the time Newsom issued the veto on September the 27th The legislators have and even tried to override a governor's veto since 1979. A veto override could require two-thirds vote in each chamber, which was achieved when the bill was initially passed. So hospitals are among the main beneficiaries of expanding nursing programs at community colleges. Henry Mayo Newhall Hospital officials said in an email statement on Tuesday that the decision to veto Senate Bill 895 is disappointing. Henry Mayo is supportive of all efforts to empower more students to pursue nursing degrees. Read an email from Patrick Moody, spokesman for Henry Mayo. Although we are disappointed Governor Newsom vetoed this particular bill, we look forward to working with the governor's office, the state legislature, and the California Hospital Association on developing solutions to the shortage of nursing in California. So I'm just curious, again, as to why. So if those of you that are in California and if you're watching the show, let me know what you think about this. I guess they were thinking about the pilot program. It looks like it got approved. I'm not seeing, there's more to this story if you want to head on over here and read the story. But I was just particularly curious as to why they won't be able to do that. So it says, according to this article, it says Newsom's vetoes doesn't mean community colleges won't ever be able to offer bachelor's degrees in nursing, only that at any movement on the issue will have to wait until the next legislative cycle. Or maybe till they get a new governor. We'll see. And I'm not saying that they need one. I'm just saying I'm not sure what the opposition was, but I'm just wondering if there was pushback from the state public universities. Just curious. Don't know. Okay. This is coming from McKnight's Long-Term Care News. And I was surprised to see this. So if those of you that are in long-term care, let me know if you've seen this. This is a concern for you. But it kind of raised red flags for me. But it says nursing home survey teams don't always have to include nurses, federal appeals court. Okay. Nursing home complaint investigations do not require a registered nurse to be part of the on-site inspection team, a federal appeals court ruled Thursday. And a 2-1 decision, a U.S. Court of Appeals panel decided that complaint investigations are not technically surveys as determined by Congress, and therefore can be made up of a less representative group of investigators. In doing so, the judges leaned on the Supreme Court's Looper-Bright decision from earlier this year, citing their new ability to determine how Congress meant its statutory language to be interpreted. In this case, the panel's majority backed the right of the Department of Health and Human Services and the Centers for Medicare and Medicaid Services to set different requirements for different types of surveys. Providers have raised concerns that without the expertise of a clinically trained inspector who understands the context in which nursing home residents are treated, survey teams may err in their findings to the detriment of operators and patients. So I have concerns. I'm going to tell you, I have concerns because I'm like, so you're going to have someone that has no medical training whatsoever conducting these surveys for complaints? What if it's an abuse issue? Will they be able to evaluate the type of injuries that the person have? Do they know what they're looking for the assessment? I just don't understand the rationale behind this. So those of you who may know, kind of chime in here because I'm flummoxed on this one. So it says Thursday's ruling differentiates between standard certification surveys, meaning the annual inspections due every 15 months, and site visits made in response to a specific complaint or other short surveys intended to monitor compliance. HHS published in 2017 a rule requiring RNs only on standard and extended surveys that, according to court documents, came in response to an earlier federal ruling in which an administrative law judge threw out a civil monetary penalty given to a New York nursing home following a complaint survey conducted by a nurseless team. Excuse me. In that original case, Avon Nursing and Rehabilitation had self-reported in 2013 an incident in which a resident tipped a bowl of hot soup in her lap, resulting in a burn. The New York State Department of Health then conducted an abbreviated standard survey at the facility. Thursday's ruling affirms a March 2023 district court decision over the objection of the providers who argued that Congress required the presence of an RN in the Medicaid Act and meant to do so for all kinds of inspections and surveys. Nursing home, so it says in a ruling highly focused on semantics and paragraph placement, the Second Circuit Court panel insisted that by leaving complaint surveys out of a specific subsection of the law and referring to them as investigations rather than surveys, Congress made clear its intent to treat them differently. So maybe we need to take that back to Congress? So the attorney, Alan Horwitz of the Arnell Golden Gregory, had filed a brief in support of the plaintiffs on behalf of AMDA, which is the Society of Post-Acute and Long-Term Care Medicine, now operating as PaltMed. So it used to be AMDA, now it's PaltMed. He called last week's ruling, illogical and potentially detrimental to patients, given how often complaints are related to clinical conditions such as falls, infections, or wounds, which makes sense. That's why I say it doesn't make sense for you not to have a nurse conducting these complaints, these investigations. Who do you think should be investigating this then? If it's not the nurse that's doing the investigation, who then is qualified? Are you going to send physicians out to do this? I don't think so. So you're going to have someone that's basically not trained in any medical to make these. I just make it make sense. I just don't understand. So it goes on to describe maybe a complaint with a family member that they've developed a pressure ulcer, and they also have diabetes. Well, they may not understand how this all works. So a licensed nurse has the clinical expertise and deep understanding of the latest practice guidelines, which would often fall outside the scope of a dietitian, a social worker, or non-nursing survey team member. And this is my question. How can you have someone else speak to the standard of care of nursing that's not a nurse? Big problem with that. So an incorrect finding of resident harm or immediate jeopardy could cost providers thousands of dollars to appeal. Conversely, he said a survey team without a nurse could also miss a legitimate serious deficiency, leaving a facility out of compliance longer and leaving patients more vulnerable. So we'll see what happens. We'll keep an eye on this, but definitely if you want to read more about that, head on over to McKnight's Long-Term Care News. There's a lot more to this story, but I just have a lot of questions. And once again, you have them wanting to cut nursing out of the picture. There has to be more respect given to nurses. I'm sorry, on the professional side. And in fact, there was actually a story that I wanted to show, but I didn't have time to purchase the article. But one of the things that they were talking about was that no longer are nurses just following the directions of others. We were never just following the directions of others. Nurses always have had an autonomous practice and were able to use their nursing judgment. It's only in recent times that we've been trying to reel that back in, and we discovered that that was to our detriment. Okay, off my soapbox. All right, let's get on to our next story, and then we'll take a quick break. This is a sad story. Again, this is going back to the hurricanes and Hurricane Helene. This is about North Carolina. It's from ABC News. It says some North Carolina nursing homes still without water 3 weeks after the hurricane. This happened to be reported about 4 days ago. But it says more than 3 weeks ago, Hurricane Helene knocked out power and running water at James Green's nursing home in Asheville, North Carolina. Today, Green, 84, and his fellow residents at Brooks Howell home still do not have regular access to safe running water for their daily activities. For 2 weeks, we've been unable to shower or wash hands. Green wrote in a letter to family and friends, which was shared with ABC News. Maintaining hygiene with hand sanitizers is a constant must. Sorry, there's a mosquito in here. It's driving me crazy. Another example is having to put a bucket of water into the tank of the toilet in order to flush. And keep in mind that our residents are old and not used to such physical activity. Oh, there is a picture. Wow. Okay, so I'm going to show this. So there's a nursing home in Asheville, Deerfield Episcopal Retirement Center, and I'll go ahead and show this just so you can guys see it. So let me present, share screen, window. I just kind of want to show it to you because I'm like, wow. So this is where a tree fell into the room of at this assisted living. You can see our home here where the tree fell through. Wow. So this is a retirement community. A tree fell through. So I just wanted to show that. It's like, look at that. All this damage, and this kind of gives a real picture to what's been happening. So I wanted to kind of share that with you. Okay. And so as we go on, it says Green Nursing Home is not the only one in North Carolina affected by the ongoing water crisis in Asheville. While bottled water is adequate for cooking and drinking, the lack of municipal running water places severe restrictions on activities like hand washing, showering, and laundry. In nursing homes, particularly, infections can travel quickly, making access to clean running water an even more urgent necessity. According to the Centers for Disease Control and Prevention, flood water from hurricanes can contaminate local water sources with germs, dangerous chemicals, human and livestock waste, and other contaminants that can cause disease. On October 16th, the City of Asheville Water Resource Department issued a boil water notice for all water customers that is still in effect, meaning that there is contamination due to the impact of the Hurricane Helene, including the potential for untreated water in the distribution system. So again, I'm hoping that they'll be able to restore this. My heart goes out to them. But it says even when the water returns, there's anticipated that facilities will still be under the boil water notice for quite some time. So we'll see what happens. But again, just really sad and everything that's been happening with them. All right, let's go ahead and take our first break. Nurses, are you tired, frustrated, and burnt out? Are you tired of being called a hero, but feeling like a zero? Are you ready to break free? I'm inviting you to feel the sun. Find the joy and passion in your nursing career. Register for the Kickstart 2024 Challenge with the Nurse Shark Academy. Come and feel the sun. Okay, so last year, this is just a little quick announcement, but last year we had our Kickstart 2024. So we will be having our challenge this year for our Kickstart. I'm going to say restart, whatever we're going to call it, 2025. That will be coming up. Last year it was a 3-day challenge. This year it's going to be a 5-day challenge. So you'll be getting more information about that. So I wanted to share that with you just to get you ready for that. So that will be coming up. So we've got some great things that are happening. I'll get into more announcements afterwards. But let's get back to the news. I have a couple more stories for you. All right. Here's our next story. This is coming from the Alabama Daily News. And again, let me know what you think about this because I just found this one also interesting as well. Nurses, what do you think? It says to retain nurses, State Board to launch new technician certification process. The Alabama Board of Nursing is on the cusp of launching a new process for certifying nursing support technicians, a process designed to both eliminate redundancies and ease workloads for nurses, of which there remains a growing shortage. This is going to be a major paradigm shift, said Peggy Benson, executive officer for the nursing board, told Alabama Daily News recently. It really is in thinking about those workers and how we can utilize them. The new certification process will create a new credential for nursing support technicians, or NSTs, and thereby make education and testing among NSTs uniform. It went into effect earlier this month after the passage of Senate Bill 25 earlier this year, sponsored by April Reaver Republican for Briarfield, the Alabama legislature's only nurse. There are about 12,000 to 14,000 NSTs employed under various titles such as patient care technicians or medical technicians. However, the nursing board does not regulate NSTs, who today require no certification and must work under the supervision of a nurse at all times. Nurses also bear responsibility for violations or infractions committed by NSTs under their supervision, which, along with the 16 different types of NSTs that each specialize in different skill sets, has been frequently cited by nurses as a source for burnout. You have all of these 16 titles, and if we can reduce them to one title across the state, then you know who you're working with and you know what skills they can and cannot do. That burnout has contributed significantly to Alabama's nurse shortage, with a survey last year indicating that more than 38,000 intended on leaving the profession within the next 5 years. Permitting the nursing board to regulate and certify NSTs under a uniform education and training program, the new process will ensure every NST carries the same skill set and eliminate the culpability nurses currently have for the actions of NSTs under their supervision. During COVID, the nurses were so burnt out because they did not have the help at the bedside and they were working very long hours. The new certification process will also help with patient protection, given that all NSTs will be required to go through a uniform certification process. Now, the hospitals do a great job of training them, but the hospital can't account for bad actors. Nurses will have a record of their bad actions, and these technicians, without regulation, do not currently. The improved safety would also extend to at-home medical care, Benson said. It is estimated to take between 3 and 5 years to fully implement as certifying the nearly existing 12,000 to 14,000 NSTs is not mandatory. Those who have been NSTs for well over a decade, Benson said, would be grandfathered into the new certification process and only be required to take a competency test rather than undergo education courses that future NSTs will be required to take going forward. So, what do you think about that? Let me know if you're in Alabama. What do you think about having these NSTs and what's going to be the scope of practice? That's the other question that I have. What's the scope of practice? Because I don't think they've really said. So those who know more knowledge of this, let me know what you have to say. All right, and this is also our Nurse Making a Difference. This is from the Gainesville Sun. And it says University of Florida College of Nursing Students Project nets human trafficking arrests. So it says Caitlin Watts never thought that in just 3 months, her graduate student project would rescue several human trafficking victims, capture accused traffickers, and become part of a hospital system screening process. Watts, a recent Doctor of Nursing Practice graduate from the University of Florida College of Nursing, said she is heartened by the results, yet saddened by the issues prevalent. Watts hopes the project helps fight the growing problem, which impacts tens of thousands of children and adults yearly in the United States. The U.S. Department of Health and Human Services estimates that up to 325 people are trafficked annually in the U.S. Florida ranks among the top states for trafficking, including forced giggity work and labor. I'm sorry, I'm trying to be careful what I say here. You see the posters and feel bad, but you don't think it's in your backyard, but it is. More and more, it's happening to kids. In many cases, it's a family member doing this type of trafficking. With the help of the University of Florida College of Nursing faculty, Baptist Health, and Epic Systems, an electronic health record software developer, Watts developed a screening tool template to identify potential human trafficking victims. The template works in the Epic system used by healthcare workers assessing hospital patients. That information then is entered into the system, raises flags that can identify a victim. Observation is a critical component, noting how the potential victim acts, their hygiene, what kind of tattoos they have, do they have a cell phone? All of these can be clues. That's why education is so crucial. Part of the education focused on interacting with the suspected trafficker. We spend a lot of time using scripts and practicing steps to take if things escalated. So Watts said her project came about after a supervisor at Baptist Health returned from a conference highlighting human trafficking. I thought that this would be a perfect project to help shed a light on a heartbreaking issue. During the project period in late spring, nurses identified 5 victims, including children, and police arrested 3 suspected traffickers in North Florida. The screening tool is available in the Epic system for use by any provider with access. This is a Rockstar project. A DMP project is about the big picture, how to improve the care for the larger group. Caitlin did that and hit it out of the park, said Renee Love, Associate Dean for Academic Affairs, Graduate Clinical Education at the college. College of Nursing Dean Shakira Henderson said the project is just one example of a big impact work done by the college students and guided by faculty. At the University of Florida College of Nursing, we empower students to tackle society's most pressing issues and find ways to enhance well-being on all fronts. Caitlin embodies our core mission of care, lead, inspire. By adapting the nursing assessment skills and technology to combat human trafficking, her project has brought focus to this unfortunate problem. We look forward to exploring her work further and evaluating its integration in UF's clinical systems. So I just want to say congratulations to her, because she is definitely making a difference there. And the fact that the system that she put in place has already netted some arrests and saved some children and adults. I think that's wonderful. All right, so let's take our next break, and then we'll come back for some announcements. Oh, no, we won't take our next break. Actually, what we will do is I wanted to share with you a little snip of our last show. So the Nurse Shark Academy show, we interview nurse business owners and leaders and invite them to tell their story. And this is for you. I wanted to be able to share this with you so that you can see what it is that we do, and invite you to come over and watch our next show and see all the rest of our shows on our YouTube channel.
9-month course, became a paramedic. And I did that for a long time. And then I was watching the nurses, and I loved how they were doing, and I wanted to see what happened afterwards. And so I went to nursing school. And as I went to nursing school and I watched that, I just kind of kept thinking, I need to help more. I want to help more. I can do more. So I went on for my undergraduate. Once I finished that, then somebody dared me to apply for the Flight Academy. I didn't really want to do it, but somebody dared me to do it just because. And I thought, I'll throw my hat in the ring. And sure enough, I was one of the applicants, took the Flight Academy, and was a flight nurse as well. And working full-time as a flight nurse and a paramedic at the same time, and then still working in the ER, I decided I was going to go back to a nurse practitioner because I felt like I wanted to be more. I wanted to help more. And so I went on to graduate school. I've always just kind of climbed that ladder.
All right, so that's just one of the little snippets of our show. I wanted to be able to share that with you to know that if you want to hear great stories like that and hear the rest of that story, head on over to our YouTube channel and watch the Nurse Shark Academy show. All right, so let's get into some announcements. So we have coming up on the 30th, we have no, it's not the 30th. Sorry. On the 26th, I am participating in a Diabetic Healthcare Expo, and that will be on Facebook. So if you would like to attend that, let me know. I'll post that as well so you can get the link to join me on the Diabetic Expo. So that is coming up on Facebook. And then on October the 31st, which is Halloween, I know, we'll be having the encore version of our Nurses Protect Your License. So we'll be talking about identity theft protection and how you can protect your nursing license and some other things that you can do to protect your license as well. So if you want to attend that event, head on over to the NurseSharkAcademy.biz and sign up for that. You can also sign up for it on Eventbrite. Eventbrite is where this is being hosted. The sign up, is on Eventbrite. So head on over to Eventbrite for the Baxter Professional Services page, and I'll post the link as well for that for you if you want to attend that. And then lastly, our big announcement is we have coming up in November, on November the 9th, it's the Start Your Own Nurse Business Workshop. So I put that on, that's November the 9th at 11 o'clock. I've put that on before with the Jumpstart Your Nurse Biz. I've done all these different things, and I thought I'd bring that back. And we still have tickets available for that event, but they are selling. So you'll want to head over to our website, the NurseSharkAcademy.biz, over to Eventbrite to get a ticket for that. But we'll talk about how to start your own business as a nurse, what types of businesses you can start. If you like, I want a business, but I don't know what, this is the place to be. We'll talk about different types of businesses. We'll give you some starting tips. So we're going to actually start building right away, and you can take massive action right when you're doing this workshop. So join us for the workshop on November the 9th. Very excited about that. Also, starting in November, we'll be doing our 30 Days of Gratitude Challenge. We'll be going live every day on our Instagram page and sharing that and going live to share what we're grateful for every day. And I encourage you to be a part of that. So start looking for some of the promotion for that as well for our 30 Days of Gratitude Challenge. And then at the end of December, right at the beginning of January, don't forget we're going to kickstart 2025. We're going to get our 5-day challenge, and we're going to get ready for the new year. So there's a lot that's coming up. I encourage you to keep an eye on things on our Facebook page, our websites, nurserockacademy.biz, on our Baxter Professional Services Health Education.com page. Follow us on the YouTube channel if you're watching us on YouTube, because we'll have great announcements there. And of course, we always like to bring you stuff from our shows. So that's it for today. I'm glad you tuned in. Thanks for watching. I will see you next week, and have a great rest of your day.